All right. So basically, what I'm going to be going over is COVID-19. It's the disease that I picked. So basically, about the disease. It is an infectious disease that is caused basically by the SARS-CoV-2 virus. It originated in 2019, hence the name COVID-19. Anyways, um, it originated in 2019, but vastly spread in January of 2020 is basically when it kind of kicked off. In 2019, there were a lot of people who were getting sick, but they didn't really know what it was. And then in the beginning of 2020 is when they started figuring out what it was. What it is that it's a very contagious disease that spreads really, really quickly. So when this disease first popped off, there was a lot of people like just left and right getting sick with the same symptoms and nobody knew what it was. So it spreads very quickly. And then as of June 1st of 2024, nearly 1.2 million people actually died from this disease. So that's really wild. So basically the etiological agent of this. So for background, it's an infection with severe acute respiratory syndrome, and the etiological agent is actually going to be the SARS-CoV-2 virus, which is basically a beta coronavirus that is closely related to the SARS-CoV. And basically the incubation period for this is it's usually within 14 days. Generally, it like stays within like 4 to 5 days, depending how severe or not severe your symptoms are. And then for the Omicron variant of it, that usually lasts about like 3 days. So the signs and symptoms of this, it's pretty familiar to like your normal like flu symptoms. So that's why they were kind of getting it like confused, like, oh, is this flu? Is like, what is this? It's kind of the same, more or less, minus a couple things. So basically, you have like your normal like fever and chills, cough, shortness of breath. You have your sore throat, congestion, or runny nose. This is the only new one, is that you can even lose your taste or smell. So that was really wild. You have like your normal like fatigue and muscle or body aches. And I will say those muscle and body aches hurt. So the transmission for this, it basically infects people with droplet transmission. So what this is that whenever this first popped off, it was like, oh, all the surfaces and all this are like contaminated. So everybody used to always carry around like there were like many hand sanitizers everywhere they went. If they touched something, they instantly put hand sanitizer on. And then like we had like a whole bunch of companies making these like stinky hand sanitizers, and it was just not fun. But basically so people it stays on surfaces. Also people can like breathe in the droplets because it is an airborne virus. um, and so what I didn't know was that it could also spread to animals, so animals can most definitely also get COVID. And for the treatment for this, so like in mild to moderate cases, most of the times, or at least me, so ever since COVID happened, I've gotten it 4 times um, since it happened in 2020. But every doctor has always told me rest, hydrate, hydrate, hydrate. And then if you need to, take like ibuprofen or Tylenol for the muscle pains. Or you can also take some like decongestants and like some like cough drops. But in like those severe cases, that requires like hospitalization, oxygen therapy, and fluids, and sometimes antiviral medications. So I know in like some of the severe cases, it was a lot of people that had immunocompromised immune systems. They did not take this disease well, so it was basically almost like a death sentence to them. Their body just couldn't handle it. So, but luckily, the patients who were usually like overall healthy, they didn't really. They kind of just like waited it out, and then the virus basically passed out of their systems. Um, but like they always say, kind of like the same thing with the flu, um, vaccination. So vaccine is the best way to prevent COVID. And yeah.